Agarwal. So please come forward. So please come forward. Dr. M.B. Agarwal is a very reputed hematologist and hemato-oncologist from the city and the country. He teaches hematology, but I will say he preaches hematology to the entire community so that many doctors inspire to take hematology as their career option. He is one of the key person who formalized hematology training in the entire country. He is an excellent academician at heart and always eager to help to grow hematology in the community. I request sir to address the audience.
Let us know. We will change it. Or do you want? We have it. We have it. Take 1 minute or 2 minutes. So friends, once again, extremely grateful to Fortis Group, especially Dr. Sanyal and Dr. Narayani for this invitation. I'm going to speak to you on hematology yesterday, today, and tomorrow. Siddharth Mukherjee, who? An Indian-born American physician and oncologist, wrote the book, The Emperor of Maladies. Chalu hai? Okay. Time described it as one of the most influential books in the last 100 years. The New York Times called it as one of the best works of non-fiction. Rebecca Skloot wrote the book, The Immortal Life of Henrietta Lacks. Henrietta Lacks, who? She was a poor black tobacco farmer with ovarian cancer whose cells, taken out without her knowledge in 1951, became one of the most important tools in medicine, vital for developing polio vaccine, cloning, gene mapping, IVF, and many more. HeLa cells have been bought and sold by billions, Yet she remains virtually unknown, and her family cannot even afford normal living. Cancer. You can snare it, burn it, or poison it. That is by surgery, radiotherapy, or chemotherapy. A lot of people, including all these celebrities, have been cured of their cancer because of chemotherapy. That is to fight the cancer without chemotherapy. And there have been breakthroughs to achieve that. And there are 6 of them listed here, and there are many more. And these 6 are targeted therapy, differentiating agents, immunotherapy, anti-angiogenesis, antimicrobial agents, and the precision medicine. My first part is related to the targeted therapy. We have been talking from the morning, the targeted therapies are important, and the classical example is chronic myeloid leukemia. And the magic was brought in by this man, Dr. Brian Drucker, 20 years ago. He discovered this drug called Gleevec or imatinib, the magic bullet, and the Time magazine once again described this on its front page. And the life of CML has been different. As you can see, chemotherapy at the bottom with short survival, Gleevec at the top with almost 90% long-term survival. Chronic myeloid leukemia became a chronic disease like living with diabetes. Goal in this year is to cure chronic myeloid leukemia and not just have a chronic lifelong disease. And Mohen from France showed that almost 40% of patients of chronic myeloid leukemia, after a few years of this tablet, Gleevec, can be taken off the treatment, would not relapse, and they are biologically cured. Moving on to chronic lymphocytic leukemia, we have another molecule called Imbruvica or ibrutinib, a targeted agent which takes care of another mutation at BTK. And as you can see over here, chlorambucil at the bottom and ibrutinib at the top, and the patient of chronic lymphocytic leukemia who would otherwise die now can go on and on a chemotherapy-free targeted agent. In cancer, 2 things happen. One is proliferation, and the second is lack of death. Apoptosis is something natural, normal, and when the cells don't die, there is failure of apoptosis. And this is because of a gene which is called BCL2. And you have a targeted agents put at the bottom, venetoclax, which induces apoptosis. So you can use both of them, ibrutinib to prevent the proliferation and venetoclax to induce death, and that combination can give a pretty long life to a patient of CLL. Not only that, the treatment can be stopped after just 2 years, which is phenomenal. So there's a new dawn in the field of hematology. Moving on, Erlen Weintraub and her dog. She wrote the book Heal, the vital role the dogs in the search for cancer cure, written by Weintraub. The book Heal describes a truth that many of us may not know. The man's best friend, dog, is extremely susceptible to cancer. In fact, 50% of the dog after the age of 10 years develop cancer, and 40% of that is lymphoma. Why is dog so prone to cancer? On the other side, this gigantic animal, the elephant, does not develop cancer. And why this difference? Why this contrast? This is because of a tumor suppressor gene that we have in our body called P53. So if you have too many copies of this, as the elephant has, it doesn't develop cancer. If you have too little of it, then you develop cancer most of the time, like in a dog, and the man is in between. So this is what this slide shows. Elephant does not get cancer because he has 40 copies of this particular gene. Sue Armstrong wrote the book on P53, the gene that cracked the cancer code. And today, hematology and oncologists are working to find out something which can take care of this P53. So that was part 1 of my talk. Part 2 of my talk is related to differentiating strategies. In cancer, you use chemotherapy, which kills the cell. Can you also make a cancer cell mature and become normal? That means, say, a myeloblast becoming a neutrophil or a lymphoblast becoming a lymphocyte. So that is differentiating agent, and that can be probably free from all the toxicities of chemotherapy. Ancient Indian medicine. This is a book written by Bengali author Aparna Chattopadhyay, and you should read that. Then Acharya Sushruta, the father of surgery, and Charak, the father of medicine. And you have the Germans giving you homeopathy and their pills, and the Chinese giving you metals, which can be used for treating cancer. One of the very important drug in hematology is shown at the bottom, and that is differentiating therapy using agents like which are vitamin A derivative or which are arsenic derivative. And today we use arsenic as a cure for a disease called acute promyelocytic leukemia. Less is more is the principle of what is written at the bottom, metronomic therapy. And metronomic chemotherapy is there to stay. There's a work going on extensively in France, and arsenic and ETRA are nothing but a type of metronomic chemotherapy. That was my part 2. The part 3 is related to immunotherapy. Why do you and me don't develop cancer? And why does that child with Fanconi anemia develop cancer? It's all related to the mutations that are taking place in our body and the way we can handle those mutations, and that's by our immune system. That means immune system is the way to control, to prevent, and to treat cancer. So this is a therapeutic approach where you make your humoral or cellular system to work against the cancer. These two gentlemen, Georges Kohler from Germany and Caesar Milestone from UK, and they went on to develop Nobel Prize. They went on to get the Nobel Prize for their discovery of monoclonal antibody, where you exploited this antibody to kill a cell which had a particular antigen. This Nobel Prize was way back in 1984. It took another 20 years for the US FDA to approve rituximab, which is anti-CD20 antibody, which we use left and right for treating CD20 positive lymphomas, which is extremely common. Not only that, we today exploit the T cell, which is the master immune cell in the body. Even the B cell is under control of T cell. So if you don't get cancer, your cancer can be treated, it is because of the T cell acting on the cancer. So why not act on this T particular cell? And here you have got antibodies which are biphasic, which on one side will attach to the T lymphocyte, and on the other side will attach to the tumor cell, bringing the T lymphocyte close to the tumor cell and killing it. And we have clear-cut examples of this, what I call BITE antibodies, in treatment of acute lymphoblastic leukemia, a drug called blinatumomab. CML became chemo-free with imatinib. CLL became chemo-free with development of Imbruvica and venetoclax. Here is the example of acute lymphoblastic leukemia. Treatment becoming chemo-free with antibody called blinatumomab, which acts through T lymphocytes. So treatment of ALL, chemo-free. Checkpoint inhibitors. Cancer cell has a method of repelling the T lymphocytes from coming and attacking it. And this is because of certain antigens on their surface called PD1 and PDL1. Now, if you can have a drug which can control PD1 and PDL1, then your immune system, your T lymphocytes can attack the cancer cell and kill it. And that is what exactly happens with checkpoint inhibitor. That is what is shown to you over here. The anti-PD1 and anti-PDL1 antibody, when you administer them from outside, you allow the T cell now to come back voraciously and kill the cancer cell. Nivolumab is an example which you use for Hodgkin lymphoma when it is relapsed after chemotherapy. So Hodgkin lymphoma, cured by checkpoint inhibitors. And this Japanese gentleman and that American gentleman got the Nobel Prize for this discovery. This is just recently, not far away, 2018. So checkpoint inhibitor. In 2022, lay press also talks about CAR T therapy. What is CAR T therapy? It's a combination of autologous bone marrow transplant and a type of gene therapy. You take out patients' T lymphocytes, treat them in vitro, develop a specific receptor against the cancer cell, inject them back. So you're doing a transplant of T lymphocytes, autologous transplant, after doing a genetic engineering in vitro. And this is the major breakthrough in hematology in last couple of years, as a result of which number of diseases, starting with childhood acute lymphoblastic leukemia, going on to high-grade lymphoma, and now myeloma, can get another lease of life. This has not yet reached the door of India, but already the work is going on. Tata has developed their center, and very soon the FDA should approve this technology in India. So from surgery to radiation to chemotherapy to targeted agents to immunotherapy, that was my part 3. And the part 4 is related to tumor microenvironment. Why does a myeloma cell survive in the bone marrow? Because it gets its food from there. If it comes into the circulation, it will not survive. So the environment is extremely important for allowing a cancer cell to progress. Make that environment hostile and the cancer cell will die. So that's another technology. Tumor angiogenesis, solid tumor people are aware of it, that the blood supply to a tumor is increased. It gets its nutrition through that enhanced blood supply. Hematologists were a little behind in it, but even leukemia, the blast in the bone marrow, is surviving on its blood supply. And this man, Judah Folkman, nobody believed on him, but he relentlessly kept working on a shark cartilage and developed anti-angiogenic drugs. And that was the genesis of various drugs in oncology today. The classical example is bevacizumab, which cuts down the blood supply to the tumor, including in hematology. And we have a clear-cut example of IMiDs, thalidomide. And you remember the story again from Germany, where the pregnant women, when they took it to prevent their vomiting, had babies without limbs. So if it can prevent the growth of limbs, it can probably prevent the growth of cancer. And that was the exploitation of thalidomide in multiple myeloma. And that's the beginning of this kind of treatment, attacking the microenvironment in controlling the cancer. So that was my part 4. We move on to part 5, and that's related to picking up the etiology of cancer. Most of the cancers, you don't have an etiology. In solid tumor, you talk about tobacco for the mouth, alcohol for the liver, smoking for the lung. But in hematology, we don't many times have an etiology, but sometimes we have. For example, H. pylori leads to gastric lymphoma, and we have hepatitis C virus leading to splenic marginal zone lymphoma, and we have Campylobacter jejuni developing a alpha chain disease, which is a lymphoma of the small gut. So when you have these kind of etiologies, you just attack that. So gastric lymphoma can be treated in 14 days by treating H. pylori and so on. So remove the bug with antimicrobials and conquer the cancer. So that was my part 5. And my last part 6, is the precision medicine. The truth in small doses. Why we are losing the war on cancer and how to win it is the title of the book by Clifton Leaf. So man has evolved. And man has evolved in this fashion, and man has evolved very well. If one of these monkey comes to your balcony, and the next day he or another one comes, you won't be able to make out whether it's the same monkey or a different monkey. But they all look alike to you. But genetically, they are different. So when you say acute myeloblastic leukemia, you're talking about one of these 5 monkeys. But inside that acute myeloblastic leukemia has got